The answer is no. Actually, a majority of chromosomal abnormalities that are happening in embryos will lead to either the embryo not developing enough even to implant, or the implantation just not being possible. Specifically, when there's a missing chromosome, which is called a monosomy, those rarely lead to implantation and then therefore miscarriage. Those monosomies and a number of trisomies will mean that you don't get pregnant. And that's part of the reason why humans actually aren't that efficient at reproduction. Even at baseline, only about 20% of couples are getting pregnant on a given month when they're actually trying. And a big reason for that is because we're creating embryos that have abnormal chromosomes that aren't even able to implant. So that's one answer to that question of no. The other answer to the question of chromosomal abnormalities leading to miscarriage, there are a small subset of chromosomal abnormalities that can lead to an ongoing pregnancy. The one that's the most well-known and the most commonly seen is Down syndrome, which is also called trisomy 21, trisomy meaning 3 copies of chromosome 21. So remember we said that we get 1 copy from the sperm source, 1 copy from an egg source, so there should be 2 copies. In trisomy 21, there's 3, and that means either the egg had 2 copies or the sperm had 2 copies of 21, and then joined with a single copy from the other gamete. And in that situation, you can have an ongoing pregnancy and even a person that is alive walking around living a life. There's a handful of other examples. Turner syndrome, Klinefelter syndrome are other examples where people can live a long, fulfilling life with their chromosomal abnormality. But majority of other chromosome abnormalities that can lead to maybe a longer gestation, not early first trimester miscarriage, but maybe even a live birth. There are a handful of those that will eventually lead to like a very early death for the infant. So trisomy 13 and 18 are examples of those. But a majority of chromosomal abnormalities are not leading to a live person. It's more likely that it will either not lead to a pregnancy at all, or that you will have an early first trimester miscarriage.